Welcome back, my dear doctors, and now we are moving towards the next topic in CVS embryology, and that is development of venous system. And this one is a very huge one and very important one. Why? Because most of the students are actually confused here. It includes development of superior vena cava, inferior vena cava, development of all the portal veins and everything. So we'll do it in a very conceptual manner. Observe very carefully. Now, during development of venous system, first thing that I want you to remember is during development, there will be three sets of veins. Number one, there will be umbilical vein. Number two, there will be Vitelline vein. And number three, there will be cardinal veins. So during development, we'll be having three sets of veins. First, let us draw a diagram for that one. For example, if this one is the embryo here, and this one here will be actually the yolk sac, and just imagine the umbilical cord over here. I hope you remember this diagram. We have drawn this diagram a lot of time. Embryo after that folds, the craniocaudal fold. So you just imagine here, somewhere here, you actually have the developing heart. Just a schematic diagram, guys, okay? Now, if that is developing heart, first of all, umbilical veins. We all know very well, umbilical veins are the one which are going to bring the blood from the mother. Okay, so imagine this one here to be the umbilical vein. And umbilical veins are the one which are going to bring the blood from mother. This source is very much important. Okay, so they are the one which are going to carry oxygenated blood from the mother to the fetus. And one more thing I would like to bring to your notice is that don't think that because I am drawing in this diagram only one umbilical vein over there, it's only one. No, it's paired. It's on both the sides. There will be a right umbilical vein as well as left umbilical vein on the other side. Similarly, you also have a vein which is going to collect the blood from the yolk sac. And the vein which is going to collect the blood from the yolk sac here will be the Vitelline vein. So Vitelline vein, it is the one which is going to collect the blood from the yolk sac, Now, why I am stressing a lot that it is going to collect the blood from the yolk sac? Why? Because we all know very well, yolk sac is nothing but the future gut. It is the one which is going to become your entire gut. So because yolk sac is going to become the gut, right now in your body and my body, gross anatomy, from the entire gut, the blood is actually collected by portal vein. Therefore, the portal vein has to be definitely developing from where only? Vitelline vein. I want you to make that idea in your mind. So yolk sac is the one which is developing into future gut, and from the gut, blood is collected by portal vein. So therefore, portal vein has to be derived from the Vitelline vein only. Then the last and third one, the third set of vein over here is cardinal. So there will be one anterior cardinal vein, and then there will be a posterior cardinal vein, and these two cardinal veins will combine together to form the common cardinal vein. So there will be anterior cardinal vein, and this one here will be the posterior cardinal vein, and these two, the anterior and the posterior cardinal vein, both of them will combine together to form the common cardinal vein. The common cardinal vein. And yes, what is the special thing about this one? The common cardinal vein, or in general, like cardinal veins, are the one which are going to collect the blood from the entire body wall of embryo. Entire body wall of embryo. From the entire body of the embryo, the blood is collected by your cardinal vein. That is the reason it makes sense. The anterior cardinal vein, anterior, which is like more towards the cranial side, that is the one which has to become your superior vena cava. I am just telling broadly. We are going to learn that in detail. So anterior cardinal vein has to form your superior vena cava, whereas the posterior cardinal vein has to contribute for the formation of inferior vena cava. So I request all of you to please remember, there are how many sets of veins, guys? There are three sets of veins during the development. Number one, umbilical vein. Number two will be the Vitelline vein. And number three will be the cardinal vein. And for everything, needless to say, there will be right and left. There will be right and left umbilical vein, right and left Vitelline vein, and then there will be right and left anterior cardinal, right and left posterior cardinal, and there will be right and left common cardinal. So needless to say that. And please remember about the source. Umbilical veins are the one which are going to collect the blood from the mother. Vitelline veins are going to collect the blood from the yolk sac, and common cardinal vein, they are going to drain the blood from the entire body wall of embryo, from the entire embryo itself, guys. Now try to recall from our very first topic in cardiovascular system embryology, we have learned about development of heart. And in the development of heart, I told you that in that heart tubes, I told you that the cranial part will be truncus arteriosus. That is going to push the blood out, that is outflow. But who is going to drain the blood into the heart tubes? That is sinus venosus. And sinus venosus has got like two horns, the right horn and left horn. I hope you are able to recall. And that's the only part that we are going to draw right now. Sinus venosus with the right horn and left horn. Why? Because all these three sets of veins are going to drain the blood into sinus venosus only. So let us include some more things in our diagram here. For example, if this one here will be the sinus venosus, it has got like two horns there. There will be a right horn and then there will be a left horn. So this is right horn here, this is left horn here, and this one here will be the sinus venosus. Perfect, no doubt about that. Now one more thing to include here is, for example, if these heart tubes are forming here, just below that there will be a septum here known as the septum transversum. Now you might be thinking, how come septum transversum will come here, sir? Because in general embryology, I said you, septum transversum is the most cranial part of the embryo. Then how come it is suddenly coming here? Yes, remember, the most cranial part of the embryo just before folding, that is important. The most cranial part of the embryo just before folding is septum transversum. And once that folds, that septum transversum will be coming here. So if this is your developing heart over here, just beneath that you will be able to find the septum, that is septum transversum. So imagine here this one will be the septum transversum. Now what is the reason? What is the reason why I am drawing this septum transversum over here? Again recall the derivatives. Again recall the four derivatives of septum transversum, guys. What is this septum gonna form? Septum transversum, it is the one which is actually going to form four structures: the central tendon of the diaphragm, as well as it is also going to form the stroma of the liver, as well as septum transversum is the one which is also going to form ventral mesogastrium, and not only that, it is also going to form the fibrous pericardium. So there are four derivatives of septum transversum, but out of that four derivatives, the one in which I am interested right now is the stroma of the liver. So you're developing heart and below that the liver. I'm getting my point over here. So your focus should be that, okay, yes, further this septum transversum will develop into what? Liver only. Now what is the reason why I'm drawing here septum transversum? Why? Because whatever umbilical vein and vitelline vein I told you, those two are the one which are going to pass through that septum transversum. So let us draw those umbilical vein and vitelline vein here, sir. So there will be right umbilical vein and then there will be a right vitelline vein. It should be in the same order. And then there will be a left vitelline vein and then there will be a left umbilical vein. So I told you umbilical vein and vitelline vein, they'll be on both the sides, and on both the sides what is going to happen, guys? There'll be like a right and left one. So let us just write down the names over here. This one here will be the right umbilical vein. I'm just writing as UV, and this one is left umbilical vein. Umbilical veins will be more towards the outer side. You have to write down in the same order. And this one here will be the right vitelline vein, and this one here will be the left vitelline vein. Then the next thing here, what about the cardinal veins? So there will be anterior and the posterior cardinal veins. So imagine this one here to be the anterior cardinal vein, and this anterior cardinal vein is going to join along with the posterior cardinal vein together to form the common cardinal. The same thing on the other side also, the anterior cardinal vein and the posterior cardinal vein, both of them are joining together to form the common cardinal vein. So right anterior cardinal vein, right posterior cardinal vein, both of them together are going to form a right common cardinal vein. Similarly towards the left side, left anterior cardinal vein and left posterior cardinal vein, and together they are actually going to form the left common cardinal vein, guys. Hope you're understanding the diagram. Previously, whatever diagram I have drawn, that was actually in the side view. Now it's like embryo, we are turning in the front and we are seeing from the front. So it's like right and left anterior, right and left posterior, combining together to form the common cardinal vein. Now, once you have understood the entire diagram here, this is the primary one, the main one. Now, from this, we are going to pick up all those veins one by one and we are going to see the fate of all of them. Like for example, first I'm going to teach you about the umbilical vein, and then the fate of Vitelline veins, and then the fate of the cardinal veins. So from this main diagram, let us take all those veins one by one and then study about their fates. So first in line, let's begin with the fate of umbilical veins. Most commonly asked questions in the exam, like right umbilical vein, left umbilical vein, what is going to happen before birth, after birth, a lot of questions. So let us see first of all what is the fate of umbilical veins now, guys. I request you to have some patience and learn this properly. Most of the time during the MBBS days, this topic is not taught in detail. So most of the students will be having a confusion. So let's learn aram se, coolly, calmly. So please have some little bit of patience and learn it properly. And better draw the diagrams along with me. Sinus venosus, and then there will be a right horn. And then imagine this one here to be the left horn. Listen the story now. It's like a beautiful story here about the umbilical veins. Then again the same thing here. Just try to imagine that this one will be the septum transversum. That's the one which is going to actually become your liver. Now the next thing here, the most important thing that we have to actually learn here is there will be a right umbilical vein and then there will be a left umbilical vein. Perfect. And then there will be a right Vitelline vein and then there will be a left Vitelline vein. Perfect. So let me just give the names again very quickly here. The outer one will be definitely right umbilical vein and this one will be left umbilical vein. This is the right Vitelline vein and this one is the left Vitelline vein. I'm not going to draw the cardinal veins and all, only whatever are required right now. So right now our concentration, our focus is on umbilical veins. So we are going to see what is going to happen to the umbilical veins. Now look at this beautiful story here, sir. I want you all to remember this like a story, not like some concept and something to mug up and all. Just remember this one like a story here. One thing which every medical student knows from the very first year onwards, out of the two umbilical vein, right umbilical vein will regress. Left is left. You know that mnemonic, very famous mnemonic. So before the birth itself, what is going to happen? A right umbilical vein will regress. It's gone. And only which is left out? Only the left umbilical vein. So therefore, out of these two, remember, right umbilical vein is completely gone, sir. Completely, it is gone. It regress. Not even a remnant of that is left there. It is gone. The only thing which is left right now is left umbilical vein. Okay. And you have to follow actually in the same sequence. Okay. First thing what is going to happen? Right umbilical vein is gone. Now the second thing what will happen is the left horn of sinus venosus. You all know this one is sinus venosus. And in the sinus venosus what is happening? There is a right horn and then there is a left horn. But what is going to happen out of these two? The left horn is also gone. Left horn is also gone. And yes, there will be a remnant of that. And we all have learned that the remnant of the left horn itself is nothing but your coronary sinus. And I have taught you this one in the development of heart. So in development of heart, inflow part, coronary sinus is developing from the left horn. Not like developing, it is actually to be like more specific, it is the remnant of left horn of sinus venosus. So remnant of left horn of the sinus venosus will be coronary sinus. Perfect. Now it makes sense when I'm telling you that left horn is gone, then it makes sense that what is the use of those veins now? So even in these veins, what is going to happen? Only the cranial part is gone. So the cranial part of left umbilical vein and then the cranial part of the left Vitelline vein is gone. Why? Because left horn itself is gone. So therefore, even the cranial part will also be gone. Now, if you people are following the sequence along with me very clearly, the only connection the only connection between the developing heart and developing liver below. I'm using the word as liver there to just keep in your mind that septum transversum here, we are using that with the concept in our mind that it is going to develop into liver. So the only connection between the developing heart and the developing liver over there is this one. This is the only connection which is left out over here. And that is the reason, my dear doctors, the name of that, it is referred to as hepatocardiac channel. So this one here will be the right hepatocardiac channel. You can clearly see there is no other connection. There is no other thing which is supplying the blood to the heart. Right umbilical vein is gone, left umbilical vein cranial part is gone, and left vitelline vein cranial part is gone. So the only one which is supplying the blood to the heart right now is only that right hepatocardiac channel. And that is also going to come like again and again later on. Why? Because you have to just remember in your mind that a right hepatocardiac channel is the only connection between liver and heart. Now you all know in your body and my body right now, what is the connection between liver and heart here? Inferior vena cava. Oh. So from here itself, make the concept ready in your mind, make the foundation ready in your mind. Right hepatocardiac channel is going to contribute for the formation of inferior vena cava. Don't think that it is done here. Inferior vena cava is like epitome of embryology. It is the complicated topic in the entire embryology, and I'm going to make it easy. There are totally six structures which are contributing for the formation of inferior vena cava. And one of that component is right hepatocardiac channel between the liver and heart. Don't worry about that. But don't shift your focus onto that one right now. Right now, our topic here is what is the fate of umbilical vein. Coming back. Till here it is okay in the sequence. So I'll just repeat all the 3 points here, guys. Whatever I taught you, I just taught you like 3 points here. Right umbilical vein will regress, number 1. Then number 2, the left horn of sinus venosus is gone, and the remnant of that is coronary sinus. And number 3, because that left horn is also gone, so therefore the cranial part of left umbilical vein and the cranial part of left vitelline vein is also gone. These are the 3 points I told you. Now after teaching you these 3 points very conceptually here, you should already get a doubt in your mind. Guys, tell me, which is the only vein which is supplying oxygenated blood to the fetus, developing fetus, oxygenated blood? It is supplied by umbilical vein. From the mother to the fetus, blood is supplied by umbilical vein, oxygenated blood. And out of the 2 umbilical vein, a right umbilical vein is already gone. Forget about that. It is regressing, already gone. Forget about that. So what is the only vein which is going to supply the blood to the fetus now? Left umbilical vein. But the problem here is that even the left umbilical vein, cranial part is also gone. Even that left umbilical vein, the cranial part is gone. So what is the only connection that is left here? The only connection that is left is hepatocardiac channel. So somehow what I have to do is, I have to develop a connection between left umbilical vein, which is going to bring the blood from the mother, and the right hepatocardiac channel. I have to develop a connection between these 2 now. Okay. So therefore, my dear doctors, remember, the left umbilical vein, whatever oxygenated blood is, bought by that. So from the left umbilical vein, that oxygenated blood will be actually sent to the right hepatocardiac channel. Why? Because that is the only thing from where the oxygenated blood can reach to the developing fetus. And what is this vein known as? This one is nothing but your ductus venosus. Remember or recall, we have learned about ductus arteriosus in the arterial system. Now this one here is ductus venosus. Ductus venosus. So that is how the entire fate of umbilical vein, you can learn it in an easy manner, like a story there. Now let us do one thing, guys. Let us first of all write down everything about the umbilical vein. That is how the blood is being supplied, and development of fetus will continue. The embryology or development of fetus will actually continue. So let us do one thing here. Let us write down all this structure, all these things, all these changes step by step in like a flow chart. Otherwise, after my class is done here, if you just look at this diagram here, you will not be able to understand exactly what is happening and when. So let us just write down like a flow chart. So what is the first thing that is happening there? Right umbilical vein regress. Gone, completely gone. After that, what is the second thing that is happening? Left horn of sinus venosus degenerates. And it's not like completely gone there. There is a remnant of that. The remnant is nothing but the coronary sinus. Perfect. And because the left horn of the sinus venosus degenerates, even the cranial part of left umbilical vein and even the left Vitelline vein degenerates. Their cranial parts are also gone. Then what is the only connection which is left now? So therefore the only connection that is left now is right hepatocardiac channel. I'm just writing in short, is the right hepatocardiac channel. That is the only connection which is left now. So therefore what you have to do right now, you got to form the ductus venosus. Ductus venosus is formed between left umbilical vein, which is bringing the oxygenated blood from the mother, and the right hepatocardiac channel. Definitely. Why? Because you need to divert the blood and you have to actually supply the blood to the developing fetus. It makes sense. And that's the reason, my dear friends, recall that is all happening like before the birth. Now what about after the birth? After the birth, you just recall, is there any use of umbilical vein after the birth? At the time of delivery, at the time of birth, what is going to happen? You and me, doctors are the one who are going to cut the umbilical cord. There is no connection between the mother and the baby now. If there is no connection, then there is no use of left umbilical vein now. So therefore, what is going to happen after birth? That left umbilical vein will close, it will obliterate. And that obliterated left umbilical vein is still present in your body and my body also right now in the form of a ligament. And that is ligamentum teres. If this is the one which is going to become like ligamentum teres after birth, now you tell me, do you even have any use of like ductus venosus after the birth? Do you have any use of ductus venosus after the birth then? No use of that one. Even that is also closed. And that obliterated ductus venosus is the one which is going to become ligamentum venosum. Ligamentum venosum. And now it will 110% make sense that ligamentum teres and the ligamentum venosum are present in the same line when you study about the gross anatomy of liver. What is this septum developing into here? Liver only. So in the liver, when I taught you in abdomen topic in the liver, when I taught you the posterior surface of the liver, on the posterior surface of the liver, the ligamentum teres and the fissure for ligamentum venosum, they'll be lying in the same line. It completely makes sense right now. So that's the complete concept regarding the fate of umbilical veins. So that is completed here. Now after that, let us take up the Vitelline veins right now. So again the same thing we are going to do. We are going to draw the same diagram again, but this time only the Vitelline veins. So what will be the fate of Vitelline veins? What will be the fate of Vitelline veins? Just try to recall in your mind the very beginning of this topic. I told you Vitelline veins are the one which are going to collect the blood from yolk sac, and yolk sac is like future gut. Gut, who is going to collect the blood? Portal vein. So in gross anatomy right now in your body and my body, it's portal vein collecting the blood from the gut. So definitely the portal vein has to develop from the Vitelline veins only. So keeping that concept in mind, let's begin now. So imagine this one is your septum transversum, and this time I'm drawing more like a liver only. So it is the same septum transversum, but we are drawing it like a liver because simultaneously even that is also developing, right? It can't remain like septum only. So manlo, just imagine that this one is your septum transversum which is forming the liver now. Perfect. Now what about the Vitelline vein? There will be a right Vitelline vein and then there will be left Vitelline vein. Now observe my diagram, how correctly I am drawing over there. I have actually stopped the left Vitelline vein there only. Why? Why? Because just now we have written there the left Vitelline vein, the cranial part of that will actually degenerate. So the cranial part of the left Vitelline vein will degenerate. Gone. Perfect. So from that big diagram, what we have done is we have just taken out only the Vitelline veins and we have to see the only fate of the Vitelline veins right now. Focus only on Vitelline vein. Ab kya hoga? What is going to happen right now? Now between these two Vitelline veins, there will be formation of anastomosis. There will be transverse anastomosis formed between them. So one will be the superior transverse anastomosis, and then there will be middle transverse anastomosis, and then there will be inferior transverse anastomosis. Request you to write down the full form somewhere else. Superior transverse anastomosis, the middle transverse anastomosis, and inferior transverse anastomosis. All these three anastomoses are formed here. Then what is the further development? The further development is everything below the middle transverse anastomosis is gone. Everything below the middle transverse anastomosis is degenerated, gone. See, embryology is all about this one only. Embryology is all about what is forming, and from there what is gone, and then what is persisting, what is remaining. So it's all like plus and minus. So what is forming, what is gone, and then what is persisting. That's all. You have to keep on playing with this one. So anastomoses are formed there, and everything below that middle transverse anastomosis is degenerating, gone. Not only that, yes, this vein is also gone here. This part is also gone. Now from here, let me do one thing here. Let me just draw the diagram of whatever is just remaining. So this one here will be the right Vitelline vein. Okay. Then this one here will be the left Vitelline vein. Okay. And this here will be the superior transverse anastomosis, and this here will be the middle transverse anastomosis. So this is the structure that is actually remaining. Now once you have understood like what is remaining, now we have to just write down the conclusions here. Let me just give another numbers here, guys. For example, this part I am giving the number as number 1, and this one here as number 2, this part. And this is the part which is actually developing into what only? Your portal vein. So number 1 and number 2, that is together going to form your portal vein. So finally in the exam, what will they ask you? Portal vein will be derived from where? Remember, the portal vein is derived from 1 plus 2. Now in the exam, don't answer there as 1 plus 2 there. Portal vein is actually derived from, number 1 is middle transverse anastomosis along with right Vitelline vein. That's your right Vitelline vein. Now we all know very well the portal vein, after entering into the liver, the portal vein will be actually dividing into the two branches just before entering into the liver itself. Not after entering, yes, before entering itself, the portal vein is actually going to divide into the right branch and the left branch. So let us just give this one here as number 3, okay, and this one here as number 4, okay, and this one here as number 5. So portal vein, just before entering into the liver, it is going to divide into the two branches, the right branch and the left branch. I hope now you can easily manage the right branch of portal vein. The right branch of the portal vein is formed by what only? Only the number 3. And what is number 3 there? The right Vitelline vein. Whereas the left branch is actually formed by the 4th and 5th one. So left branch of portal vein is formed by the number 4 plus number 5. What is number 4? Number 4 is nothing but the superior transverse anastomosis, along with number 5 is nothing but left Vitelline vein. So you got to finally remember this thing here. Again, the same thing I would like to tell you, there is no way that you can just mug up this one, guys. Almost impossible to remember all these things for long term. The best way, these diagrams should be like imprinted in your mind, and the best way to learn these diagrams, practice. You got to practice this one. So the portal vein, and then it is dividing into, so this is your portal vein over here, and this is dividing into the right branch here, and this one will be the left branch there. Perfect. Now try to recall the histology part of the liver. In histology, we have learned that the portal vein will be actually entering into the liver, and it will be present in that portal triad. And if you remember that liver lobule, hexagonal lobule of the liver, it is going to supply the blood, and that blood will be going through the sinusoids. Between those hepatocytes, so there will be sinusoids, and the blood will be going through that. And from there, the blood will actually go into the central vein. And from the central veins, it is actually going to combine to form your hepatic veins. And from the hepatic vein, finally, the blood will be draining into the inferior vena cava. Now that entire sequence is all derived from the Vitelline vein only. It's all derived from the Vitelline vein only. So let us just write down in the conclusion here, what are the derivatives of Vitelline vein? What will be the derivatives of Vitelline vein? Number 1 and number 2, you can just write down those veins which are going to form the portal vein. So portal vein is formed by number 1, splenic vein, and that combines with the superior mesenteric vein. So splenic vein and the superior mesenteric vein, these two will combine together to form your portal vein. And portal vein, it will actually supply the blood to the liver, and in the liver it will be draining the blood into the sinusoid. So even the sinusoids of the liver are also derived from the Vitelline vein. And after sinusoids, from there the blood will go into the central vein. Even the central veins in the liver are derived from Vitelline vein. And those central veins are going to combine together to form your hepatic veins. Hepatic veins. So even the hepatic veins are also derived from the Vitelline vein only, guys. So all these structures, whatever I have written here, all of them are derived from the Vitelline veins only. And in one of the exams, they have tested about the sinusoids of the liver. So sinusoids of the liver are actually derived from where only? From the Vitelline vein only, guys, without any doubt. Perfect. So that is about the fate of Vitelline vein. I hope it's made easy with the help of these two simple diagrams over here. Now, if you recall the very beginning of this topic, I told you there will be 3 sets of vein. So we are done with the fate of umbilical vein. We are done with the fate of Vitelline vein. The only thing left out right now is what will be the fate of the cardinal vein. There will be anterior cardinal vein and the posterior cardinal vein, and they are going to form your superior vena cava and inferior vena cava. So let us see the formation of the superior vena cava as well as the inferior vena cava. So now let us see what will be the fate of the cardinal veins, the last in the line here. Okay. So the fate of cardinal veins now. But in the cardinal veins, as I said you, we have actually the anterior cardinal vein, and then there will be posterior cardinal vein, of course the right and left one, and then we have got the common cardinal vein. And we can understand from the common sense, guys, the right and left anterior cardinal vein, they are the one which are going to form superior vena cava, and right and left the posterior cardinal vein, they have to somehow contribute in the formation of inferior vena cava and other veins. So we are going to see them one by one. So let me first of all draw that our main diagram here, guys. For example, if this one will be the right anterior cardinal vein, and this one here will be the left anterior cardinal vein, and then there will be a posterior cardinal vein. So first what I am doing is I am actually concentrating only on the anterior cardinal vein, not the posterior. So this one is the right anterior cardinal vein, and this one is the left anterior cardinal vein, and they have to actually contribute in the formation of superior vena cava. But now apply common sense. It's nothing like anatomy or embryology right now, guys. Common sense. When you see in the gross anatomy, superior vena cava, is it exactly in the center? Absolutely no. Superior vena cava is not at all exactly in the center here. Superior vena cava is little bit towards right. Okay, so that explains us perfectly about the right anterior cardinal vein. Okay, fine, no problem with that one. But what about the left anterior cardinal vein? The left anterior cardinal vein, whatever blood it is draining, there is nothing like another superior vena cava over there. So somehow what you have to do is, whatever blood which is being drained from the left side, even that you have to actually shunt towards the right side. And that will be done by the formation of one anastomosis here. So whatever blood is coming from the left side, even that is also shunted towards the right. And that is done with the help of a vein here or anastomosis in the middle, and that will be your oblique anastomosis. So there will be oblique anastomosis formed in the middle, guys. So therefore, both from the right side as well as from the left side, from both the sides, the blood will be collected and drained into the superior vena cava there. That's the concept here. And later on, what is going to happen? This remaining part will be degenerated. This remaining part will be gone. So let me again do the same thing here. It's all about embryology, and embryology is all about what is forming, what is gone, and what is remaining then. So let me just draw the diagram with what is remaining here. So I am now remaining with the anterior cardinal vein only on the right side. And that is going to combine along with the posterior cardinal vein. Together they are going to form common cardinal vein, of course the right one. and then I am just remaining with the left anterior cardinal vein along with the oblique vein. So this is the exact situation now. So those two will combine together to form superior vena cava, and I hope already in your mind, that picture is coming already in your mind. Oh, so now we can compare this embryology with the gross anatomy. Yes, superior vena cava is formed by the right brachiocephalic vein and the left brachiocephalic vein. And we have seen n number of times in anatomy books, the left brachiocephalic vein is more oblique when compared to the right one. Right one is more vertical here, the right brachiocephalic vein, whereas the left brachiocephalic vein is like more oblique there, guys. That makes perfectly nice concept here. Now it is only about writing the notes and completing the thing here. Superior vena cava is formed by, superior vena cava is actually formed by number 1 and number 2. So what is this number 1 and number 2, guys? Superior vena cava, number 1 plus number 2. What is this one? Number 1 is nothing but the right common cardinal vein, and number 2 is nothing but the right anterior cardinal vein. Perfect. I'm not concerned with the entire part or the cranial part or caudal part. At least if you remember that, more than enough. Right anterior cardinal vein. Then give this as number 3 over here. And what will be this number 3 here, sir? It is right brachiocephalic vein. Right brachiocephalic vein. And that is formed by only number 3. And what is number 3? That's again your right anterior cardinal vein. And let us give this as number 4 and this as number 5 over here, and that is going to form the left brachiocephalic vein. And the left brachiocephalic vein is formed by number 4 plus number 5, and these two together are nothing but, number 4 is oblique anastomosis or oblique vein, plus number 5 here will be the left anterior cardinal vein. The left anterior cardinal vein. Perfect. So that completes the development of your superior vena cava also, as well as the right and left brachiocephalic vein comfortably. Once you have learned about the normal development of the superior vena cava, now let me tell you one abnormality. Now one of the abnormality which was already given in your exam, again same like an image based question there, guys. Double superior vena cava. A person having double superior vena cava. Now I have taught you so crystal clearly here, you yourself can decide how come will you be having a double superior vena cava. Double superior vena cava will be there because of persistence of left anterior cardinal vein. If this part persists here, if it remains there, then double superior vena cava will be present there. At the same time, you also have to remember, yes, why it is persisting? Why? Because there will be absence of oblique anastomosis. If that oblique anastomosis is not formed, then the blood from the left side is not coming towards the right side, then automatically there will be another superior vena cava present abnormally. So therefore we can just write down here one of the abnormality here, double superior vena cava. Double superior vena cava, the right as well as left superior vena cava. Why it will be present, guys? It will be actually present due to persistence of left anterior cardinal vein. Persistence of left anterior cardinal vein. And why is it so? Why? Because since absence of oblique vein. Absence of oblique vein or oblique anastomosis we can say. So double superior vena cava is actually due to the persistence of left anterior cardinal vein, and that too due to the absence of oblique anastomosis. Now one more MCQ I want to say from here itself, guys. We all know the superior vena cava is actually going to go and drain into the atrium. Superior vena cava will actually go and drain into the right atrium. We all know that. Now suppose if there is a double superior vena cava, if there is a right superior vena cava as well as left superior vena cava, then where will that left superior vena cava go and drain the blood? The left superior vena cava will actually go and drain the blood into the coronary sinus. It is actually going to go and drain the blood into the coronary sinus. What is the reason for that one? Why? Why it is going to, or how it is going to go into the blood into the coronary sinus? It's very simple. Imagine here sinus venosus, and sinus venosus has got that right horn and the left horn. Our same diagram from the very beginning, and I told you here you'll be actually having that umbilical vein and the Vitelline vein, and then you'll be having that umbilical vein and the Vitelline vein on the other side also, and even the common cardinal vein. So if even the left sided, even if the left side, if you have this superior vena cava present there, the left sided superior vena cava will actually go and drain into left horn. And what is that left horn of the sinus venous is going to form? Coronary sinus. So left horn of the sinus venous is going to form your coronary sinus. That's another possible question, guys. Double superior vena cava, most of the students easily answer. Double superior vena cava is formed due to the persistence of left anterior cardinal vein, fine. But if it is present where it is going to go and drain the blood, it drains the blood into the coronary sinus. Perfectly done. That completes the development of the superior vena cava. Now let us see the development of inferior vena cava. So now let us learn about the formation of inferior vena cava. That is the last and final thing in the line here, guys. Okay. Now inferior vena cava, we already know it will be formed from where? It will be formed from the posterior cardinal vein. So this time what we are going to do is, suppose if this is the anterior cardinal vein in the common, and this one is a posterior cardinal vein. Similarly on the other side, this one will be the posterior cardinal vein here, guys. So this one here will be the right posterior cardinal vein, and this one here will be the left posterior cardinal vein. I hope you're understanding. This time we are not concentrating on the anterior cardinal vein. Already we have discussed in detail about the formation of superior vena cava. Now during the development of this venous system, at the same time even the kidneys are also forming there, and from the kidneys the blood has to be drained here. So there will be formation of another set of veins over here, actually referred to as your subcardinal vein. The subcardinal vein, and these subcardinal veins are going to drain the blood from the kidney. So for example, here you actually have your right kidney, and then there will be a left kidney over here, and from the kidneys, remember, I hope you have learned in the urogenital system, kidneys are metanephric in origin. Our kidneys will be developing from the metanephros part, but the blood vessels there will be mesonephric in origin. So therefore those veins are said to be the mesonephric vein. So whatever I have drawn that in the red color there, that is nothing but the mesonephric veins, and that will drain the blood into subcardinal, and subcardinal veins are going to further get connected cranially and caudally with the posterior cardinal vein. So that is your subcardinal vein. So let me just write down the name here. This will be the subcardinal vein. And not only this, remember, between these two subcardinal veins, there will be formation of anastomosis over here, and this anastomosis is referred to as intersubcardinal anastomosis. Makes sense? The name is very simple. So this one here will be the intersubcardinal anastomosis. Intersubcardinal anastomosis. Now apart from that, one more set of veins will be formed on the posterior abdominal wall. Obviously this is all happening on the posterior abdominal wall. One more set of veins is formed here, supracardinal vein, and even that supracardinal vein is also connected with your posterior cardinal vein, guys, in this manner. So this vein here will be the supracardinal vein. So first I want you all to learn the names of all these veins here, guys. So this subcardinal, supracardinal were not required in our previous topics. That is why unnecessarily I did not include them before itself to avoid confusion. So now it is required, we are including that right now. So posterior cardinal vein, then we have got the subcardinal veins, and then we have got the supracardinal vein. All this set of veins, I hope you have learned the names now. Now how come all this is helping in the formation of inferior vena cava? To learn that, what we'll do is, the same diagram we are going to draw it again, but without the names, and let us draw it in dotted lines there, guys, so that we can highlight the only one thing which is actually going to be remaining or persisting, guys. So therefore you imagine this one here to be the right posterior cardinal vein, and this one is the anterior here, and similarly you imagine this one here to be the left posterior cardinal vein. Perfect. I'm not going to write down the names again and again there, already we know the names there. And then imagine here this one to be your right kidney, and this one here to be the left kidney, and then from the kidneys what is going to happen here? The blood will be draining into the mesonephric vein into the subcardinal. Perfect. And at the same time, I told you there will be one more set of veins present over here, that will be supracardinal. And the same thing on the left side also, there will be supracardinal. And these two are actually connected in the middle with the help of intersubcardinal anastomosis. Exactly the same diagram. The only difference here is that yes, we are drawing that in the dotted lines. Apart from all this, I want you to also recall in your mind, like we have here the right hepatocardiac channel. Hope you remember, I told you right hepatocardiac channel is the only connection between the liver and the heart. Liver and the heart here. And what is the only connection between the liver and the heart right now in your body and my body? Gross anatomy. That is nothing but the inferior vena cava. So even that will also contribute for the formation of inferior vena cava. Perfect. Now again apply the concept in the same manner. Superior vena cava, when we have learned, I told you superior vena cava towards the right. Therefore, whatever blood is present towards the left side, that has to be shunted via the oblique vein, oblique anastomosis. Similarly, inferior vena cava, the same case. Inferior vena cava is also formed towards the right. Then what should happen from the left side? The blood should be shunted. Let's see how. So what is happening over here is, for example, if this one will be the right posterior cardinal vein and this is the left posterior cardinal vein, and between these two there is a formation of anastomosis. So because of this transverse anastomosis, the blood is shunting towards the right here. So what is the name of this one here? This one is nothing but your transverse anastomosis. Transverse anastomosis. And because of this transverse anastomosis, the blood from the left side is coming towards the right. And once the blood comes towards the right, then let me tell you exactly what is happening here. How is the inferior vena cava formed? There will be an anastomosis formed between, let me take another color here. There will be anastomosis formed between the supracardinal and subcardinal. And there will be one more anastomosis formed between the subcardinal and the right hepatocardiac channel. Right hepatocardiac channel. So now everything is ready. Complete platform is ready. Let's do that right now. Let's see the formation of inferior vena cava. Let's conclude this topic right now. So inferior vena cava is formed from here. Number one, right posterior cardinal vein. Number two, right supracardinal vein. Number three, anastomosis over here. Number four, the right subcardinal vein. Number five, anastomosis again here. And then number six, right hepatocardiac channel. So as I promised you, exactly 6 structures are going to actually contribute for the formation of inferior vena cava. So let us do the same thing again. Let's follow the same pattern again. Write down the numbers over here. And then along with me start writing the notes right now. Inferior vena cava. So inferior vena cava is formed by, what is that number one there? That is a right posterior cardinal vein. What is that number two there? That is a right supracardinal vein. And what is that number three there? It is actually anastomosis. And you all know very well that anastomosis is between what? That anastomosis is between the supra and subcardinal towards the right side. And what is number 4 here? Number 4 is right subcardinal vein. And what is number 5 again? Number 5 again will be the anastomosis. And what is that number 6? Number 6 is right hepatocardiac channel. That is going to form the terminal part of inferior vena cava, the last part of the inferior vena cava, hepatocardiac channel, and from there the inferior vena cava is going to drain the blood into the right atrium. So that explains, our diagram explains here very clearly about the formation of inferior vena cava in a crystal clear manner. Now not only the inferior vena cava formation here guys, let us see the formation of some other veins also in this diagram. So simple to understand here. Subcardinal vein, you can clearly see this one, the cranial part here and this cranial part here, it's going to drain the blood. Let me just draw an arrow mark here so that you can understand the direction of flow of the blood. So that is the cranial part of the upper part or cranial part of the subcardinal vein. And if it is above, definitely it has to develop into what only? Suprarenal vein. This is the caudal part. And caudal part, definitely it has to form the gonadal vein. the gonadal vein here, guys. Okay, so therefore let us just write it and finish it off. Suprarenal vein. Suprarenal veins, which are going to drain the blood from the suprarenal gland or adrenal gland, they are derived from the cranial part of subcardinal vein. Cranial part of subcardinal vein. Whereas the gonadal veins, they are the one which are derived from the caudal part of subcardinal vein. Wow. Clear here that you don't have to worry about anything over here, guys. Just keep on practicing the diagram and you will keep on getting the answers automatically. Once you are done with that one, now let us see the last and final thing. What about the renal vein then, sir? Remember the right renal vein. The right renal vein will be derived only from the mesonephric vein. Whereas the left renal vein is derived from the mesonephric. And then what is this vein in the middle here? That is your subcardinal. And what is this here? That is the anastomosis here. All the three of them. And from here you can clearly understand, from the embryology you can clearly understand why is the left renal vein more longer when compared to the right renal vein. Okay. So therefore, right renal vein is very easy. It is only and only derived from the right mesonephric vein. But whereas the left renal vein, it is derived from three sources. Number one, it will be derived from the left mesonephric vein, and then left subcardinal vein, that subcardinal vein which is in between those two, sandwich between that one. And then what is that anastomosis between them? It is intersubcardinal anastomosis. That's the one which is going to form your left renal vein. I'll just highlight here so that you can understand more clearly. This is the right renal vein over here and this is the left renal vein. It is formed from three sources over there. And one more thing which is very much important, we have been learning from your first year MBBS days, more cautiously we have been learning. Left suprarenal vein and left gonadal vein. The left suprarenal vein and left gonadal vein, these two are going to drain the blood into the left renal vein, not the inferior vena cava. And it is actually proved from embryology today, guys. Left suprarenal vein and left gonadal vein, both of them are going to drain the blood into left renal vein, not into inferior vena cava. Whereas only the right suprarenal vein and even the right gonadal vein are going to drain the blood into inferior vena cava, not the left one. Even one more thing has been proved from here very, very clearly. Now, once you are done with all this normal development of all these veins over here, now the abnormality. What is abnormality? Development of double inferior vena cava. I think we have done like so much of cardiovascular system embryology till now. You yourself can decide right now. How come double inferior vena cava will be formed? It's so simple. Persistence of left posterior cardinal vein and then left supracardinal vein, and then not only that, even the anastomosis here, guys. Subcardinal, sorry. So the persistence of the left posterior cardinal vein and then the left supracardinal vein and then the anastomosis here and even the subcardinal here. So if that vein is going to persist, then what is going to happen? It will lead to the formation of double inferior vena cava. So let us just write down that abnormality and finish off this one here. So double inferior vena cava is due to what? It is due to persistence of left posterior cardinal vein, number one, and then left supracardinal vein, number two, and even that anastomosis along with the left subcardinal vein. So it is due to the persistence of all these veins. But the problem here is that all these veins together, they have given a common term, and that is known as the sacrocardinal vein. It is referred to as the sacrocardinal vein, and that was the term actually given in your exam. So take care about that. So double inferior vena cava is actually formed due to the persistence of all those veins, and all those veins together, they have given a common term, and that is sacrocardinal vein. If you say that, that's more than enough. So that is about the development of all your veins, that is inferior vena cava, suprarenal, gonadal, and then renal veins, and even the superior vena cava. So all those veins development has been done in a crystal clear and easy manner, guys. That's all. Thank you.